Good evening, everyone. Today's topic is imaging findings in pulmonary tuberculosis. There are different stages of infection. First is primary pulmonary tuberculosis. Second is secondary tuberculosis. Third is the miliary tuberculosis. Secondary tuberculosis is also known as post-primary pulmonary tuberculosis or the reactivation tuberculosis. So, for first of all, we will start with the primary pulmonary tuberculosis. In primary pulmonary tuberculosis, the initial focus of infection is usually subpleural and the tuberculous caseating granuloma, which is also known as tuberculoma. It is seen in the subpleural location. It is known as gone focus or the gone lesion. So, initial focus is the gone focus, and infection will spread via lymphatics and leads to the involvement of the mediastinal lymph nodes. So, if it is gone focus along with ipsilateral gone focus along with ipsilateral mediastinal lymphadenopathy, that is known as gone complex. That is known as gone complex. And the third is the Ranke complex. So, what is Ranke complex? It is a calcified gone complex. It is a calcified gone complex. It means calcified gone focus plus calcified mediastinal lymph nodes. Calcified gone focus with calcified mediastinal lymph nodes is known as Ranke complex. It is basically a progression of the gone complex. When calcium starts depositing over the gone focus and the mediastinal lymph nodes, it is known as Ranke complex. And other important things you will see in primary pulmonary tuberculosis is the pleural effusion and the pulmonary granulomas usually heal by fibrosis. So these three important things you should always remember. One is the gone focus, gone complex, and the Ranke complex. Second is post-primary pulmonary tuberculosis, also known as reactivation tuberculosis or secondary tuberculosis. It occurs years later, frequently in the setting of the decreased immune status. What are the most common sites? Posterior segment of the upper lobes, superior segment of the lower lobes. The typical appearance of post-primary tuberculosis is the patchy consolidation, and very important about the secondary tuberculosis is cavitations are very much common. Cavitations are very much common. So what are the CT findings? On CT you can see is the train bud sign. On CT you can see is the train bud sign. There is endobronchial spread along the nearby airways. That is a common finding in post-primary tuberculosis. Train bud is basically multiple areas of centrilobular nodules with a linear branching pattern. With a linear branching pattern. Next is Miliary tuberculosis. In miliary tuberculosis, there is actually hematogenous spread of the uncontrolled tuberculous infection. So, through the blood, there is spread of the infection. It carries a relatively poor prognosis. It is associated with the tubercular infections in the other tissues and the body organs. And on X-ray, on chest X-ray, you will see small tiny nodules scattered in both lung fields. There's here also you can see multiple tiny nodules. So these are the small tiny nodules which are seen in bilateral lung fields. It is typically seen in miliary tuberculosis.